Okay, assessment for chapter 16. The patient with eating or weight problems. 22-year-old female medical student is brought to your clinic by her mother, who discovered she was making herself vomit after meals. Which of the following is suggestive of a diagnosis of anorexia nervosa rather than bulimia nervosa? A. Body weight at least 15% below expected for weight. B. A dread of fatness and a distorted image of being too fat. C. Use of herbal dieting medications. D. A tendency to exercise excessively. E. Preoccupation with being thin. Of course, the answer is A. So that's it. All of the other options would be there in bulimia and in anorexia. The weight of a 13-year-old boy is 25% lower than expected, having previously been on the 50th percentile for both height and weight. He has not started puberty. He reports that he eats well and denies any concerns regarding body image. What's the most appropriate next management step? Refer to psychiatric assessment, refer for cognitive behavioral therapy, investigate for physical causes of growth restriction, try to establish rapport to facilitate assessment, ask him to keep a food diary. I think the answer is okay. I would say investigate for physical causes of growth restriction. Okay, why is that? Yes, of course, patients with eating disorders often deny their symptoms, but it's very important to exclude other physical illnesses that can cause the weight loss before attributing these symptoms to a psychiatric disorder. That's it. A 32-year-old barmaid is worried that she has lost a great deal of weight recently, body mass index 17. She describes feeling tired all the time and having no appetite. Her mood has been low for the last 3 months, and she is anhedonic. She drinks 6 vodkas and cokes when she is working, and 3 on her days off. If she does not have a drink, she feels anxious and gets palpitations. She is sometimes sick, not always after meals. Physical examination and investigations reveal no abnormalities. What is the most likely diagnosis? Bulimia nervosa, depressive episode, severe panic disorder, anorexia nervosa, or alcohol dependence? The case here is alcohol dependence. You can see that through a lot of hints within the question. Self-neglect due to alcohol or substance use is a common cause of weight loss, so that would be the cause of the main complaint here. And dependence is suggested by her withdrawal symptoms when she does not have access to alcohol. Low mood is commonly associated with alcohol excess, as alcohol is a depressant, of course. Okay. Another case. A 25-year-old female lawyer has a diagnosis of anorexia nervosa with a body mass index of 14.5 kg per meter square. Which of the following investigation results requires urgent treatment? Glucose 3.7, hemoglobin 97 gram per liter, total cholesterol 7, phosphate 0.7, or potassium 2.1. Of course, potassium 2.1, and if that's the case, she requires an electrocardiogram and cautious intravenous replacement of potassium, of course. On the other hand, hypoglycemia, anemia, hypercholesteremia, and hypophosphatemia are all common in anorexia nervosa, but the values given here are not dangerously low as potassium. A 19-year-old female accountant describes a dread of fatness and feels that she is overweight despite having a body mass index of 13.6 kilogram per meter square. She describes a 1-year history of severely restricted her dietary intake. She reports amenorrhea secondary and has lanugo hair. Which of the following is the most likely diagnosis? Depressive episode, severe, bulimia nervosa, paranoid schizophrenia, anorexia nervosa, or obsessive compulsive disorder. And the case here is obvious. We are talking about anorexia nervosa. She is dangerously underweight. And she has the dread of fatness and the distortion of body image with disturbances in menses. All of these would indicate amenorrhea, anorexia nervosa. Okay. 17-year-old boy has anorexia nervosa and receiving weekly weights and physical examination. Which of the findings below places him at high physical risk? Blood pressure 95/65, supine, and 88/60 millimeter erect, or capillary refill time less than 2 seconds, heart rate 58 beat per minute regular, or temperature 36.5, or unable to raise from squatting without assistance. So that's the answer, E. Unable to rise from squatting without assistance. His blood pressure and heart rate place him at moderate risk, but his capillary refill time and temperature are within the normal range, so there's no problem with that. Okay. So let's go to the extended questions. Here we have psychiatric causes of low weight: schizophrenia, specific phobia, depression, severe without psychotic symptoms, or bulimia nervosa, alcohol dependence, Alzheimer's, dementia, acute psychotic episode, anorexia nervosa, or obsessive compulsive disorder. For the case vignette below, pick the most likely psychiatric cause from the list above. First, a 42-year-old man with schizophrenia has a body mass index of 17 with evidence of rapid weight loss. He denies any problems with body image. He says he is a little lonely as his mother died recently and they used to live together. However, his mood is not pervasively low and there are no acute psychotic symptoms. Okay, so here the problem would be I think so here we are talking about I think it's not just it's just schizophrenia, that's it. So and sometimes schizophrenic patients are not able to look after themselves due to negative symptoms of schizophrenia, and because of the impairment in motivation and executive functioning. His mother may be the primary carer for him, and that's why when she died, he is not taking care of anymore. So that's why. Okay. A 19-year-old male student was admitted to a general medical ward after collapsing in the street. He denies any problems and tells you it was probably just a funny turn. His BMI is 22. Serum potassium is 2.1 millimole per liter. There are U waves in his electrocardiogram. And do you notice that his carotid glands appear swollen? So here we are talking about what? We are talking about person with Can you see it? So the patient is telling you that he's fine, but maybe the patient has bulimia nervosa, because we have here hypokalemia, swollen parotid glands. All of these can be caused by excessive vomiting. And of course, this U waves in electrocardiogram can be present, of course, because of hypokalemia also. A 16-year-old girl has lost 15 kilograms in the last 3 months, giving her body mass index of 16. She denies any body image concerns, but tells you that she is only able to eat food prepared in a specific time-consuming manner. She knows this is irrational. However, if she does not do this, the prospect of contamination with food-borne pathogens causes her to have unpleasant panic attacks. Here we are talking about obsessive compulsive disorder. She has obsessions about, fear of infection and compulsions to prepare the food in specific manner and so on. A 62-year-old ex-model has recently begun to lose weight and her BMI is 18. She has a past history of anorexia nervosa. She reported that she could not bring herself to eat because of intense worry that she would vomit. Anytime that she has tried to eat, she has suffered a panic attack and had ended up vomiting. She suffered from a severe case of norovirus about 6 weeks ago. So the patient here maybe has some kind of phobia, specific phobia from vomiting, despite the history of anorexia nervosa. A 21-year-old plumber with no past psychiatric history has recently lost 12 kilograms, causing his body mass index to fall to 15. He appears incredibly frightened and tells you that the owners of all the food shops in his locality are poisoning his food on behalf of government agents who want him dead because of his involvement in recent terrorist attacks. So the patient here is delusional. So where's the options? So we are talking about acute psychotic episode or such. Let's get back to the no past psychiatric history. Yes, we are talking about acute psychotic attack. Anyways, about physical consequences of eating disorders, we have lanugo, caries, cirrhosis, Russell sign, onychorexis, alopecia areata, and cheilitis. We have also acrocyanosis and striadyskinesia. For the statements below, select the most appropriate descriptive term from the list above. The fine downy hair often seen in the body of sufferers of anorexia nervosa. This is lanugo. Erosion of dental enemas caused by repeated vomiting. This is caries. Dry nails often associated with anorexia nervosa. This is this word, which is onycho, which means nail, so fingernail. So onychorexis. Okay, let's say onychorexis. This is dry nails often associated with anorexia nervosa. Stretch marks on the abdomen associated with rapid changes in body weight. This is stria distensi. Stria, and a callus on the knuckle that may develop as a result of self-induced vomiting. This is Russell's sign. So, but you should know that cirrhosis in general, this is dry skin that may be present in anorexia nervosa, also in hypothyroidism. Alopecia areata, that is spot baldness, and it may be in some kinds of, I would say, trichotillomania or something. Okay. Cheilitis, this is the inflammation of the lips, which can occur in bulimia or nervosa, in bulimia or anorexia, that is related with vomiting. Okay, so that's it.